The Southern Eye Clinic, owned by Dr. Rahi Sharma, OD, and located in Atlanta, Georgia, is conducting a community awareness campaign on the importance of healthy eye care. Dr. Sharma and his staff are presented in the video to demonstrate the important factor of healthy eye care. When I take good care of my body in general, does that ensure good eye health?
Normally when we engage in a good lifestyle, both dietary as well as active lifestyle, we can maintain the best optimal health overall. However, there are external factors that actually influence the outcome of our best visual possibilities. One of the first external factors would be ultraviolet light. And ultraviolet light is very important, but for some reason the society does not understand the importance of it, so I'm here to actually educate everybody about it. Ultraviolet is the #1 cause of cataracts in the world. Number 2, ultraviolet can also cause a lot of premature aging around the periorbital area. Number 3, you notice with the ultraviolet radiation that actually comes, the part of the eye called the sclera, the white part, it actually can change the tissue composition and become more fibrovascular, hardening, so whenever we blink, we don't get a nice consistent blink. So parts of the eyes end up drying out a little bit, and that can end up causing a lot of people to engage in teary eyes, red eyes, itchy eyes. And this is commonly seen in patients that actually live in very hot climates. I see this in a lot of the Latin population, as well as the African population of a lot of West Africa, and as well as people in the equatorial area where there's a good amount of sunlight year-round. The other external factor I want to discuss is that of macular degeneration, which is also caused by ultraviolet light. So these are external factors that influence the eye. But just because we're in good health, it doesn't mean necessarily our eyes will be in the best. You notice with women, they go through what's called postmenopausal, which is an imbalance in their hormone level, which has actually been shown to cause a difference in the tear production, and more importantly, a decreased tear production, which can result in red eyes, itchy eyes, watery eyes, in a condition known as keratoconjunctivitis sicca, which is commonly known as dry eyes, which is counterintuitive because if the eyes are dry, why are the eyes actually watering? And that's because we don't have enough lubrication because of the lack of tears. So there's no what I call the WD-40 for the eyes, which is the tears. They don't rub against each other, and as a result, your eyes end up tearing.
When should we begin to take specific care of our eyes?
I think as early as possible. There are some doctors that actually check the eyes as early as 6 months. I'm actually very comfortable with around a 4-year-old. Reason being is because we want to make sure the eyes are actually protected. The first reason being refractive. And when we mean refractive, we mean the best vision possible. A lot of times, patients will never complain, especially a child who hasn't learned to talk. What is their visual outcome? Are they actually seeing the very best possible? And sometimes we just have to use our objective skills to determine, is their vision the best it can be? So I always recommend around 6 months with special pediatric ophthalmologists to make sure the eyes are actually developing correctly. But then at about 4 years old, it's very important to actually get them checked by an eye doctor for visually, in terms of by then they've learned how to talk, they've learned how to at least beginning how to read, and you can get a little bit better assessment of their vision. So you can correct any discrepancies such as whether they're nearsighted, whether they're farsighted, or whether they have astigmatism, because these 3 issues can actually affect their learning and their academic performance down the road. So even though we say, 4 years old, if we can correct that, they can actually pursue a very good academic lifestyle down the road, as opposed to catching it later, which is still good, but we want to always try to catch it as early as possible.
Are there any dietary supplements that effectively support eye health?
Actually, they are. I'm a big advocate of just taking a regular multivitamin, where it always supplements, especially in today's world, we're living a very fast lifestyle. We may not be getting the right type of dietary what I call ingredients. But there are multivitamins for under 50. I could suggest that. And then there's some that are over 50. That works well. But also more important with patients who, for example, who have macular degeneration, they are actually supplements that specifically cater to their condition to prevent oxidative damage to the back of the eye. So that's one way I'm going to answer that question. The other one, instead of a pill, very important to make sure whenever we're outside we actually have a good quality pair of sunglasses, to say, polarized sunglasses. I don't recommend the ones you buy over the counter at your local drugstore because they don't block enough ultraviolet light, which is the #1 cause of problems, ocular speaking, in our general population. There's one that, for example, with women who have dry eyes that I discussed earlier. Dry eyes, they actually do have some data showing what you can do is you can actually take what's called flaxseed oil, which is actually very good, as well as a very rich pharmaceutical grade omega-3, omega-6 pill. And if you can, it's a nice big horse pill, but needless to say, as long as you can take it, it can actually provide some lubrication to the eyes and can give women a lot of benefits so they don't end up tearing a lot, having the condition as we know as dry eyes. And it's always a good overall protection to the back of the eye.
Is poor eyesight hereditary?
Poor eyesight, it can be hereditary, and I'm going to answer that in two different ways. First one being refractive, the second one being medical. What I have noticed is, in certain type of populations, parents who have a lot of astigmatism per se, their children can develop the same type of astigmatism, or if somebody is nearsighted, farsighted, likewise. So yes, it can be hereditary, poor eyesight. However, the other factor I want to talk about is environmental. Environmental could be, now we're getting into a digital era where there's a lot of blue light that's being radiated from the smart media devices, tablets, laptops, fluorescent lighting, LED lighting, and all of what blue light is a certain wavelength of light that actually, once being emitted, is actually shown to cause problems in the back of the eye, in the part that's most important to eye doctors called the retina, because that is the actual information that goes to the brain. So we have environmental factors with that. The other way, systemically, medically, I can answer that question is macular degeneration, as I discussed earlier. It's commonly seen in the Caucasian population, but needless to say, it is seen across all races. That can be hereditary. So it's very important whenever we go to the eye doctor, when we do a nice case history, it's always good to let them know if anybody in the family actually has such conditions as very high prescription or macular degeneration, so that we can actually start to look for problems. So yes, it can be hereditary. However, we can have environmental factors. The other way I'm going to also answer this question is, during my parents' era and their parents, there was, academia was big, but we did not have as much as I call homework as we do today. In today's world, there's so much information that's being delivered to our kids through computers homework, or as well as just traditional paper and pencil type homework. And constant strain on the eye eventually can cause patients to actually develop some type of eye condition, whether nearsighted or farsighted. So hereditary and environmental factors are the two causes of people to end up having some type of condition. But yes, it can be hereditary.
What other advice can you give to help maintain good eye health?
What I would like to add is it's very important to get routine eye exams done on a yearly basis at the minimum. A lot of people don't think it's expensive, but it really is not. It's actually an investment in your future, because the eyes are actually a camera to the world, but more importantly, it's a camera to your world. And without maintaining a good ocular health, you can miss so much things in life. For example, glaucoma is one of the leading causes of blindness in the African American population. And the key point I'd like to address with this, it's asymptomatic, meaning there is no signs of you're having a problem. For example, I'm going to compare that to a common cold. You get a scratchy throat, maybe your nose starts irritating, you feel a little bit weak. So these are all signs that can tell you something is developing. However, with glaucoma, there is no signs. It just slowly takes your vision away. So just because we may be in good health doesn't necessarily mean your eye's in the best of health. You could possibly have glaucoma. You can actually have a broken blood vessel in the back of the eye. We can call that, like a mini stroke. You may never know that. We've had patients many times who just come in for a routine exam and they can't see out of one eye, and they were not aware, because whenever we see, we use both eyes. Very rarely do we actually go around covering one eye just to check our vision. So it's very important, and I stress everybody, please just make sure you get your eyes checked. It's actually the best investment for your future, so that you can actually see your loved ones and you can actually enjoy a good quality life for many years to come.
How can a person know what to look for when selecting eyeglasses?
When selecting eyeglasses, the number one thing I would always look at for a patient would be their prescription. A lot of times when patients come in, they already have a frame in mind that they want to have, but they may not be the best frame for them. So the number one thing we would look at is their prescription, what type of prescription they have and what frame would be best for them, for their features, their personality. We also look at colors. We look at the size of the frame. The number one thing also is their budget. Those are things that we always have to take in consideration. A lot of times patients don't understand what their prescription require. They might need a larger frame, or because of the shape of their face, if it's oblong, or they just may need high index lenses for a thinner prescription, to have thinner lenses, and we want to make sure that we're giving them the best frame for that prescription. We add a lot of additional things that the doctor prescribed to the patient's lenses, as far as polycarb, high index, transitions, polarized sunglasses. So there are a lot of options that a patient has when they come in according to their prescription.
If a person wears regular eyeglasses, can they also wear contacts?
Certainly they can. A person that wears eyeglasses, depending on their prescription, whether it's just a spherical prescription or they may need corrections for astigmatism, and that determines how much astigmatism they have, or they may be a glasses wearer who needs a bifocal, a contact lens wearer who's wearing bifocals. So all of that is determined on the patient's prescription. According to the patient prescription, pretty much anyone can wear contacts, whether those contact lenses are soft, they could be gas permeable, or they could be a multifocal lens.
Can a person wear contacts if they need bifocal lenses?
Yes. Again, we always specify about the patient's prescription for the bifocals before we determine whether, before the doctor prescribes, what contact lenses are best for them. But yes, they can wear contact lenses. Bifocal wearers can wear a multifocal bifocal, which is a soft lens, or they can wear a bifocal toric lens, or they can wear a gas permeable lens. So yes, they can wear contact lenses if they're wearing bifocals.
Do you think it's important to have eye insurance?
Eye insurance is very important. It is very important that we get the health of our eyes checked on an annual basis. And in getting our eyes checked, we need to make sure that we're getting a dilated exam. And getting a dilated exam, it allows the doctor to help to see if you have issues such as glaucoma or diabetes.
Does general health insurance cover eye prescriptions and glasses?
General health insurance does cover conditions, eye conditions and surgeries, but most of them may not cover prescriptions for eyeglasses or for medication. So you may need to purchase an outside or another insurance to make sure that your routine eye exams are covered.
How much does eye insurance cost the average individual?
On an average of individuals, it could range from $250 or more, depending on what you're needing. And a family, as much as $600. It depends on the family size and what you're needing as far as the insurance.
What should I look for when obtaining an eye insurance policy?
In looking for eye insurance, we need to make sure that we are getting a routine eye exam, that it covers for our glasses or our contacts, and we may also need to make sure that if we're having any other issues concerning our eyes, that it will also cover that. In choosing an insurance, you need to make sure that not only that you choose an insurance that works for you, but to make sure that you know your insurance. Make sure that you speak to your representative and let them explain everything to you concerning your insurance. So when you're going to your appointments, you will be well aware and informed of what your insurance covers and does not cover.
This program is being brought to you as a community service program of CAU TV.